I chain smoke and I say fuck a lot. But I accept myself for the way I am. I accept you too. Viewer discretion advised.
If I get corona, I get corona. At the end of the day, I'm not going to let it stop me from partying.
He says, yes, coronavirus, young guys don't get it, only old people get it. I'm not going to let it stop me from partying. I'm going to go when they were partying down on the Florida beach.
And now he's dead.
You can't find that video anymore.
That was just a joke Chris Rock told that Cuomo thought was fucking hilarious. But apparently the guy's not dead.
We interrupt our program to bring you this important message.
C60 in oil is a powerful antioxidant that moves through the body like a magnet to attract and neutralize free radicals. Gotta get rid of those radicals. C60 can slow down aging and reduce cell damage. It can also improve the immune system and reduce inflammation naturally. And I got extra virgin olive oil. Not bad. If you're interested, check out my link in the description. Nutty.
Now back to our show.
This video is dedicated to the memory of everyone we've lost over the last few months, due in some way to our current crisis, and especially our fathers. Happy Father's Day. Before we get started, let me tell you a little story. I'll make it quick. I was born and grew up in Massachusetts until I was 11. We moved to Myrtle Beach, South Carolina. After we moved here, things were tough for a while. My stepfather and mother ended up getting a divorce, and that's when they told me the truth, that he wasn't my real dad. I had no clue. Now, fast forward to about 10 years ago. I found my biological father online. And then in 2016, we finally flew up and I met my father. And I had been there 4 times since 2016. Got to hang out here and there. He was pretty cool, pretty laid back like me. And then this last December 2019, he ended up passing away. I'm not telling you this because I want sympathy or anything like that. You know, I'm good. I'm actually really happy because had I waited much longer, I would have never met him. So we actually got to hang out a few times and I appreciate that. I know if he would have made it a few more months, he would have been a COVID death, but he wasn't. He died before this whole issue. So he died in December. They didn't bury him until May 22nd. I don't know what the hell took so long, but I know I couldn't go. So I sympathize with anybody that's lost loved ones in the last few months, and you weren't able to say goodbye, or you weren't able to bury them the way they wanted to. Unless, of course, we were protesting, rioting, or attending a George Floyd memorial. Some reason you don't get sick from those. I still haven't quite figured that out yet. And I definitely sympathize for anyone who had family in nursing homes and lost them and you weren't able to say goodbye.
Jose Gutierrez was 88 when he passed away on April 19th. He'd been at Brooklyn's Cobble Hill Health Center since late January. He lost his life like so many other Americans not long after nursing homes stopped all non-essential visits, including by relatives, as overwhelmed facilities tried to keep the virus out and admittedly struggled to keep families informed about how their frail and vulnerable relatives were doing.
Families with relatives at this nursing home in Andover outraged and heartbroken after learning more than a dozen bodies were kept in a small morgue. The deaths believed to be linked to the virus, and now they have no direct communication with their loved ones, many of them dying alone.
The state health department only recently released data about nursing home deaths after intense public pressure. And some families have told horror stories of not being notified by nursing homes about their loved ones' conditions or even deaths.
The nursing home is responsible for providing appropriate care. If they cannot provide that care, then they have to transfer the person to another facility.
I am also outraged that bodies of the dead were allowed to pile up in a makeshift morgue at the facility. New Jerseyans living in our long-term care facilities deserve to be cared for with respect, compassion, and dignity. We can and must do better.
There are at least 13 coronavirus deaths in Beaver County, and one of the hot spots for the outbreak continues to be Beaver County's largest nursing home.
So about a month ago on May 23, 2020, I did a video called To Protect the Elderly about a 20-year-old that tested positive for the cove named Jaden Hayden. He was put in a Michigan nursing home where he proceeded to beat the shit out of old people and film himself. Father of 20-year-old patient who beat elderly man at Detroit nursing home says son shouldn't have been there. Wait a minute, he wasn't working there? The video of a 20-year-old brutally beating an elderly patient at a Detroit nursing home has gotten national attention. Now police are investigating a possible second incident caught on camera, while the young man's father says there's more to the story. The 20-year-old was on video beating an elderly patient earlier this week. The father, who asked not to be identified, said his son has had several health issues, has autism, and called from a group home in Chelsea last week to say he wasn't sleeping, was feeling anxious, and hearing voices. Quote, "I just don't want people to think he's this vicious individual. He's got mental issues." He said his son called 911 and was taken to a mental health facility in Ann Arbor. Last Wednesday, he was diagnosed with COVID-19 and said he was supposed to be taken to another facility to be quarantined. Quote, "It should have never happened because he should have never been put in that environment." His father also says there's a pending case in Washington County where his son is accused of assaulting a staff member at another group home. The young man's father says he had serious behavioral problems for a long time and should have been closely monitored at Westwood. Quote, "Had I known he was there, I would have never consented to it." Meanwhile, an attorney for Westwood Nursing Center tells Fox 2 they were unaware of the attack until they saw the video. They're investigating the situation and cooperating with the police. I guess it was common practice for quite a few states. June 15, 2020, Steve Scalise just sent these letters to the Democrat governors of New York, New Jersey, California, Pennsylvania, and Michigan, demanding they explain why they ignored protocols and forced COVID-19 patients into nursing homes. The outcome was devastating. Families who lost loved ones deserve answers. This tragedy was avoidable. 116th Congress of the United States, House of Representatives, Select Subcommittee on the Coronavirus Crisis. June 15, 2020. The Honorable Andrew M. Cuomo, Governor of New York. Dear Governor Cuomo. The Honorable Gretchen Whitmer, Governor of Michigan. Dear Governor Whitmer. The Honorable Gavin Newsom, Governor of California. Dear Governor Newsom. The Honorable Tom Wolf, Governor of Pennsylvania. Dear Governor Wolf. The Honorable Phil Murphy, Governor of New Jersey. Dear Governor Murphy, the ongoing COVID-19 pandemic has disproportionately affected the elderly, especially those living in nursing homes and other long-term care facilities. We write, seeking information at a granular level about the science and information used to inform your decision to mandate nursing homes and long-term care facilities admit untested and contagious COVID-19 patients from hospitals. This decision likely contributed to the thousands of elderly deaths in New York State. Thank you for your attention and prompt response to this important inquiry. On March 13, 2020, the Center for Medicare and Medicaid Services issued guidance, quote, for infection control and prevention of coronavirus disease 2019 in nursing homes. The guidance is a blueprint for individual states to follow when determining how best to control outbreaks of COVID-19 in nursing homes and long-term care facilities. This guidance does not direct any nursing home to accept a COVID-19 positive patient if they are unable to do so safely. In fact, it says, quote, nursing homes should admit any individual that they would normally admit to their facility, including individuals from hospitals where a case of COVID-19 was or is present. Only if the nursing home can follow CDC quarantining guidance. CMS Administrator Seema Verma said, quote, under no circumstances should a hospital discharge a patient to a nursing home that is not prepared to take care of those patients' needs. CMS did not mandate COVID-19 positive patients back to nursing homes, but instead stated that a COVID-19 case at a hospital does not preclude the nursing home from accepting a COVID-19 negative patient. On March 25, 2020, the New York Department of Health issued on their website a now deleted directive on, quote, hospital discharges and admissions to nursing homes. This directive said, quote, no resident shall be denied readmission or admission to the nursing home solely based on a confirmed or suspected diagnosis of COVID-19, and nursing homes are prohibited from requiring a hospitalized resident who is determined medically stable to be tested from COVID-19 prior to admission or readmission. For clarity, this advisory mandated nursing homes accept known COVID-19 positive patients and, further, mandated that nursing homes not even test patients for COVID-19 prior to admission. According to the most recent available data, New York has suffered 6,360 nursing home deaths related to COVID-19. That is more than 25% of the state's total COVID-19 deaths and more than 4% of the state's entire nursing home population. To help us better understand what science or guidance you used to make this lethal decision, we respectfully request the following documents and information. 1. All state-issued guidance, directives, advisories, or executive orders regarding hospital discharges to nursing homes, or any and all other types of assisted living facilities, including those previously superseded in chronological order. 2. The total number of COVID-19 related nursing home deaths, including deaths that occurred at the nursing home and deaths of a registered nursing home patient at a hospital, by day between January 1, 2020 and present. 3. The total number of COVID-19 related nursing home positive cases, including individuals who tested positive at a nursing home and individuals who tested positive at a hospital, by day between January 1, 2020 and present. 4. The total number of confirmed or suspected COVID-19 positive patients returned to a nursing home or other long-term care facility between March 25, 2020 and present. 5. All information, documents, and communications between the Office of the Governor and the New York State Department of Health regarding COVID-19 mitigation in nursing homes and other long-term care facilities. 6. All information, documents, and communications between the New York State Department of Health and any and all of the state's nursing home administrators. In addition to these documents, please provide a staff-level briefing no later than June 18, 2020, which was yesterday. This briefing may be conducted remotely for convenience and safety issues. To schedule the briefing or ask any follow-up or related questions, please contact Committee on Oversight and Reform staff. The Committee on Oversight and Reform is a principal oversight committee in the U.S. House of Representatives that has broad authority to investigate, quote, any matter at, quote, any time under House Rule X or 10, I don't know. Further, the Select Subcommittee on the Coronavirus Crisis is empowered to investigate, quote, preparedness for and response to the coronavirus crisis, including the planning for and implementation of testing, containment, mitigation, and surveillance activities. Thank you in advance for your cooperation with this inquiry. Sincerely, Representative Steve Scalise, Ranking Member, Representative Jim Jordan, Representative Blaine Luetkemeyer, Representative Jackie Walorski, Representative Mark Green, MD. The other 4 letters were pretty much the same, except they featured their state's statistics and data. One thing I did notice was Governor Newsom of California seemed to be offering bribes. You even provided a monetary incentive, or bribe, in nursing homes offering $1,000 per day per patient to a facility willing to take in COVID-19 positive patients. And according to the California Association of Long-Term Care Medicine, this move made no sense. The only way it does make sense is if you would look at it the other way, if he was trying to make people sick. And they were supposed to comply by June 18th, but I think they're just still ignoring it or blaming it on political bias. So we'll see what happens.
Like so many other homes, Warburys is battling dire staff and equipment shortages. But even more worrying, the home's owner has told Sky News he's been asked to take in patients from hospitals who are actively suffering from COVID-19.
I know that absolutely everybody said no. And there would be a very good reason for that. That would be tantamount to importing death into care homes. The care homes have done all the right things, against all the odds, to add insult to injury by asking us to take COVID-19 positive patients, is asking us to basically make out the suicide note for people in care.
This guy's the only one that made any sense to me, and it seems like common sense. And I don't even know what country he's in.
Fucking stoned.
I got